Well, thank you for joining us for this, I think, really important module for the CML program. This one is about treatment-free remission in chronic phase chronic myeloid leukemia. I'm chairing it with Katia Pagnani from Brazil. And we've got, I think, 5 really, really good lectures, interviews to cover this area. I think treatment-free remission really is an emerging and very important goal for most patients with chronic phase CML today. And I think it's really incumbent on every CML clinician to be familiar with this, to understand the prerequisites to conduct treatment-free remission attempts safely, and how to manage patients appropriately during that TFR attempt. So to cover this area, we have Mari Copland from the UK. She's focusing on the biology of treatment-free remission in terms of the leukemic stem cell, but also in terms of the immune response. I think she's providing an excellent overall background to us understanding treatment-free remission as well as we can in 2021. Narini Shanmuganathan from Adelaide is giving us a historical perspective on treatment-free remission and underlining the critical predictors of success with treatment-free remission. And I join with Ehab Atala to give an Australian and a US perspective on how we manage the discussion with the patient, how we manage the monitoring, really all of the practical issues regarding treatment-free remission. And then Katia Pagnani from Brazil and Hemant Malhotra from India are giving perspectives from low and middle income countries as to how they manage treatment-free remission in their particular region. So that's, I think, an important perspective for us. And finally, we have a great presentation from Gian Antonio Rosti from Italy, giving us an understanding of how many patients regard treatment-free remission and a sort of a personal perspective on how he approaches it for each patient when he introduces the topic and how he talks about it with his patients. So I think over these 5 presentations, you'll get a really good feel for how to manage treatment-free remission in your practice, if it's appropriate, if you have the right technology available to you. So I hope you enjoyed. I thank Nicola Evans and Arlene Harris-Buchan for putting this all together. And now please go ahead and check out the presentations. Thank you very much.